Hi, I'm Dr. James Repko, board-certified podiatrist here in Tampa. The holidays should mean shopping, family gatherings, parties, and travel, not hobbling around with foot or ankle pain. But every year, we see the same pattern. People wait until the pain is unbearable, right when they need their feet the most. What starts as mild discomfort in October can become a limp by December. And the truth is, foot and ankle pain usually doesn't get better just on its own. Something like plantar fasciitis can progress from a morning stiffness to a constant pain. An ankle sprain left untreated can turn into a chronic instability. Nerve pain can worsen with holiday stress, sometimes leading to permanent damage. So what are some common holiday problems that we see and treat on an annual basis? Most commonly, I would say heel pain and plantar fasciitis. It's pain that gets worse throughout the day or whenever you get out of bed in the morning. Morning heel pain that makes it hard to get moving and get going. There's swelling on the inside of your ankle, sometimes on the bottom of your heel. But at Bayshore Podiatry, we have our plantar fasciitis excellence program. It combines orthotics, laser, and shockwave therapy. Most patients are seeing relief in about 2 to 4 weeks. If you have an ankle sprain that's been bothering you and you can't put weight on it, or swelling that won't go down, numbness or tingling in your toes from your ankle sprain, we use same-day ultrasound in our office to assess damage so you can skip the ER and get answers right away. Another common thing that we see around the holidays is nerve pain, burning, tingling, numbness in your foot, usually between your toes. You feel like you're walking on a marble or your socks balled up, maybe something hard in the ball of your foot, electrical tingling sensations in the ball of your foot. But with early intervention with MLS laser therapy, injections, and orthotics, we can prevent it from becoming permanent and needing surgery. We're equipped with the latest technology right here in the office between diagnostic ultrasound and digital x-rays with same day and no waiting for weeks for imaging. We have MLS laser therapy to reduce inflammation quickly and speed up healing, with relief often happening within 1 week. We also have shockwave therapy, which is FDA cleared for chronic heel pain and tendon pain with 90% success after about 3 to 4 sessions. For those in the worst of shape, we have advanced needs like PRP and worsens jelly as well. So why do patients choose us? Well, aside from our over 500 5-star reviews on Google, we know that the holidays are busy, and we tailor plans around that. We have lunchtime appointments for busy executives and parents who need early and morning or later evening appointments. We have those available too. We also have spots for travelers who need an intensive plan before leaving for a big trip. And we always reserve urgent care slots during November and December, but they do tend to fill fast. So don't let heel or ankle pain ruin your holidays. Early treatment can make the difference between weeks of recovery and 2 months on the sideline. Call us at 813-877-6636 or visit us online and schedule an appointment freely with our online booking platform. Make the most of this holiday season. Don't let pain keep you down.